Good afternoon, and thank you for joining today's webinar. I am Sherilyn Francis with the Georgia Health Information Technology Extension Center. The future of health IT is here. Turn it on. We invite you to connect with us at www.gahightech.org and via social media at Georgia High Tech. We present to you today's webinar entitled Effective Strategies for Maximizing Your Practice's EHR and Information Technology Investment, presented by Ms. Phoebe Nelms and Mr. Christopher Cunney. Georgia High Tech is Georgia's only federally endorsed expert to assist providers in the achievement of meaningful use EHR technology. We are located at the Morehouse School of Medicine National Center for Primary Care. Why Georgia High Tech? Because Georgia High Tech is here to assist you in meaningful use, macro quality payment program, and health information exchange information. We invite you to contact our support center at 877-658-900 or connect with us via our website at www.ga-hightech.org. Strategize for success now. In compliance with ACCME guidelines, none of the presenters have financial or other relationships with manufacturers of any commercial service discussed in this educational activity. The objectives for today's webinar are to identify effective strategies for vendor communication and partnership, to discuss training essentials, to outline workflow optimization and the use of shortcuts, to discover how to turn IT into a utility, and to explore technology oversight and governance. And now, Mr. Cunney.
Good afternoon, everyone. It's a pleasure to be here today. I am going to spend the next 45-50 minutes chatting with you about various strategies and approaches to optimizing your technology investments. So at a time when the American provider are offering some of the best healthcare in the world, even the smallest practices cannot slip. They must offer top-tier services while meeting and maintaining compliance government regulations. This is really no small order for many practices, and it's made increasingly difficult considering the price tag that comes with implementing and integrating cutting-edge technologies, in particular EHRs. Solo practitioners or practices with just a handful of doctors struggle quite a bit with making those investments. For example, is a comment here on this slide from one of a pediatrician that says, maintaining the electronic health record system is our largest expense. Even the Medical Group Management Association states that it costs literally almost $33,000 per year for each physician in a practice to maintain the technology that's currently being used today. And that cost continues to rise on an ongoing basis. And so we recognize that the physician investment in technology is a challenge, and the goal here is to try to maximize that investment as much as possible. Once practices have made that initial investment for an EHR and or the practice management system, there are ways of maintaining the ongoing costs associated with it, and overseeing that it can often be a challenge. The reality of it is that despite the need to make that initial investment, there will be a need of constant upgrading, replacing, adding on, and integrating that technology into their practice and to other systems going forward. The challenge also is, how do we also get our staff to fully maximize the use of that technology and effectively get the return on investment in it? And so today we'll talk about some few strategies and methodologies on how we do that. So as was mentioned earlier, the seminar will offer what I believe are some practical approaches to maximizing the practice's EHR investments and provide real strategies for commoditizing those emerging IT expenses. We'll talk about the vendor relationship and how that's an important component to making sure that the implementation goes effectively and the ongoing care and feeding of the technology happens. The importance of effective training of the staff and the clinicians who use the technology. Continuing to optimize the workflow and the technology's use. how do we start to look at IT now as a utility and buy those services on demand? And then the importance of the governance and oversight associated with the technology itself. So, congratulations. Your practice has gone through, I'm sure, a very exhaustive process of looking at various different vendors, looking at your budgets, and have now either made the decision to implement an EHR practice management system and or have already gone down that path and now are actively using that technology. And now, what many practices believe should be the easy part. Well, and the reality of it is it's not. Now that you've implemented these systems, the care and feeding of the technology, the optimization of the technology, and maximizing the return on investment now becomes the challenge for these organizations. So when a practice first adopts an electronic health record, there are lots of things for them to learn. Some of them that can be confusing for those professionals who are not traditionally technology experts. That's where it's very, very important for us to take a look at really this first strategy around vendor communication and partnership. Traditionally, most organizations look at vendors as kind of this outside organization that we have an arm's length relationship with, when in reality, they should become an extension of your organization, an extension of the IT component associated with that. They play a very integral role in ensuring the successful implementation of this technology, as well as ensuring that the ongoing care and feeding of it and the roadmap associated with that technology is actually realized. Interesting enough, according to a recent report by Class Enterprise, EHR vendors can play a critical role in increasing the usability of the EHR systems. After actually interviewing over 160 different healthcare providers, they discovered that the more those vendors are involved in the implementation process, the greater the success these healthcare professionals have in the use of the technology and maximizing that investment and the full adoption of that technology within their practices themselves. It's also important to note that some practices have reported that the EHRs are hard to use. Typically, can be found that there was a poor communication, a poor relationship with the vendor during the implementation process, and that poor relationship continues to continue after that implementation has taken place. So it is absolutely critical for a practice to build a strong relationship with their vendor partner and understanding the technology that they're getting ready to make a long-term investment in. And not only understanding what that relationship will be, but getting that commitment from that vendor partner to position themselves in an extension of their overall organization. So there's a number of things to consider, in this vendor communication, and that is there's the implementation process, as I mentioned earlier, and then the ongoing use of the technology once it's been implemented. And so during the implementation process, the vendor should be taking a very active approach. To the implementation of the technology. You as an individual should be actively asking questions of the vendor during that implementation section. For example, will my workflow need to change to maximize the use of the EHR technology? Do I need to use hardware? What type of hardware do I need to purchase to install in the systems itself? Who should be installing that technology? Who should be supporting the technology during the implementation? What about training and the aspects of training associated with it? Who are my contact people that I need to be working with on an ongoing basis within the vendor organization? What services will the vendor provide during the implementation and post-implementation? And what are some of the cybersecurity considerations I need to be thinking about as I start to now leverage these solutions? And then after that implementation and during the go-live phases and after go-live, what are some of the successful practices should an organization take in owning that technology? Who will be those central points of contact within the practice that the vendor will be working with. How often should they be meeting, and what types of training should that individual should continue to invest in after the implementation takes place? This is a good practice because it prevents, really multiple avenues of communication between the practice and the vendor. And it also streamlines that EHR process. So once the practice has established good relationships, it's good to have an understanding of what the vendor's plan is, what the future enhancements and upgrades are. And most vendors should know what the development cycle is so that you're online with that and you understand when these upgrades are going to take place and how they're going to impact your organization and the practice that you're a part of. When it comes to addressing the challenges with the EHR technology, healthcare providers should not hesitate at any point to approach their vendors with any questions that they have. It's important for you to have a good understanding of how this EHR functions, what its limitations are, and what capabilities it actually has so that you can set expectations within your internal practice itself. In addition to the roadmap, it's important for the practice to also make sure that that solution will cater to their specific practice's needs. And so you need to make sure you've done your due diligence in meeting with other practices who've implemented these solutions, working with your local regional extension center to make sure that that application has been vetted properly, and then making sure they understand what your key goals and expectations are in the use of this technology. It's also important to take into consideration the total cost associated with the implementation. It's not just the initial licensing of the technology, but what about the hardware, the network, the security considerations, as well as the ongoing cost of staff and personnel that are going to be needed to maintain that technology. And most importantly, it's really, really important to understand, are there any limitations around or considerations around cybersecurity and the protection of that patient information? So I'll stop here for a second and see if there are any questions.
Oh, hi, Chris. This is Phoebe with Georgia High Tech.
Hi, Phoebe.
And this is such valuable information that I wanted to ask a question. It seems as if this communication has to be established early on, and that some of the things that foster this good communication should actually be included in the contract, and that practices should actually really see what all of the support that's available, that's included in their contract, that they optimally utilize that.
No, absolutely. That's a very good point. I think in the beginning phases, as you're starting to look at, the EHR practice management system or any technology that you're using within your physician practice, understanding what the contractual responsibilities are from the vendor, establishing regular communication and actually having that written in the contract and requiring that as a part of their responsibilities. And then also understanding what the penalties are associated with the service levels that are supposed to be delivered by the vendor as well, too. Having those conversations up front, getting that information documented in the contract at the beginning phases puts everyone on the same page in terms of what the expectations are of the vendor, as well as what the expectations will be of the customer, the practice itself. Establishing those up front will be an important way of having very effective communication with the practice and with the vendor.
Thank you. That makes sense.
You're welcome. So continuing on this concept of vendor communication and partnerships, one of the things I'm very, very bullish on, quite honestly, is this concept of disruptive vendors. And when I use the term disruptive, I use that in a very positive way. Many practices can find real advantage in reaching out to emerging technology companies, and not just some of the standard vendors that are out there. Working with those innovative companies can, in many cases, allow you to get very customized solutions for your practice. Can give you the ability to get solutions at a discounted price. And in some cases, these vendors are looking for clinical partners to help vet out their technologies as well too. And so there's opportunities for you to provide input in the design of the solutions that they're eventually going to bring to market, or to customize those solutions in future versions of those applications as well too. And so some of the products and services that you might not be able to find the functionality in some of the more traditional solutions that are out there might be found in some of these more disruptive or emerging technologies that are in the space as well. In addition to that, and we'll talk about this a little bit later, you might be able to implement those technologies through more cost-effective methods like cloud-based solutions, as or mobile-based technologies as well, which can extend the reach of your practice through those technologies and to your patient population as well. So as a result, they're able to offer these products in many cases at a much more competitive price point. They're much more flexible in customizing the product to meet your specific needs, and they're very open in many cases to establishing really long-term relationships with these practices because they use them as resources to provide input in the design of their products going forward. So if you haven't looked at some of the kind of emerging technologies that are out there, I would encourage you again to reach out to your regional extension center or reach out to a consultant that you have built a relationship with to help you identify what's in the marketplace today to meet your specific needs. Any questions?
You actually answered it.
Okay.
How do you discover these disruptive vendors and then vet them?
Absolutely.
That could be a whole nother webinar.
It could absolutely be a whole nother webinar, and I would encourage you again to reaching out to your regional extension center if you've got a relationship with a consulting group today. If you've got existing technology partners that you're working with, that you have a confidence in, talk to them as well. They may have some insights to some emerging solutions that are in the market today. So moving on to strategy number 2, training. I just want to, if I don't emphasize one thing that you get out of this seminar today, it's this component of it, and that's training and the importance of training in the successful implementation on long-term return on investment in your solution that you acquire, whether it's your EHR or any other system that you purchase. It is imperative that you make an investment in your staff and understanding how to use the technologies that you're acquiring. Many practices fall short on, and healthcare organizations fall short in this area because of the need to and feeling to be expedient in this implementation, or their perspective on not being able to set aside the appropriate time because we're losing potential patients or revenue. You really come out, on the short end in the long run when you don't make this investment because you don't give people the ability to effectively understand how to leverage this technology most effectively in your practice. And so you end up having, in many cases, individuals who aren't comfortable with the use of it. They may be improperly trained. And as a result of that, bad data in, bad data out, or individuals who are frustrated. And in some cases, you may have an employee who was one of your best individuals, one of your best staff members, who gets frustrated and moves on because they feel like they can't be successful because the training was not delivered in the most effective way. So effective staff training is one of the most important things an organization should be considering. And again, that training has to be delivered, based on where the organization is. No two individuals operate the same. You have individuals in your organization who are very technically savvy, and in some cases you have individuals who may not have ever touched technology at all, or on a very limited basis. It's very, very important for an organization when they're going through this process, whether in the beginning phases of the implementation and through the overall life cycle of the technology, to constantly keep the pulse on their staff's understanding and knowledge of the technology itself. So medical professionals and physician offices shouldn't be treated in similar fashions and using similar training methodologies needed when it's important to understand how they think and operate. It's important for you to work very closely with your vendor to understand what options are available, and I highly stress the need for face-to-face training, in-class training, versus initial webinars. If you can get that type of one-on-one face-to-face training in the initial phases of this, I find that to be the most effective way for individuals to get comfortable with new technology that they've not had any experience with. It also gives them a chance to ask questions, gives the trainer an opportunity to see them demonstrate their ability to use the technology in an effective way, and then identify those individuals who might need even more one-on-one training or hand-holding after that initial training has been done. So office staffs must be focused on the training session, and to do it properly, the office should actually find ways to limit the amount of patient flow that's taking place during that process. So if you can close the office or set aside some dedicated time for the staff to deliver that to deliver the training to that staff, I think that's the most effective way to deploy it. You reduce the stress level when staff aren't having to worry about answering phones and emails and patients coming up to them, or doctors or other care providers coming up to them while they're trying to learn an entirely new application and workflow in some cases. Another factor for success is the establishment of a training and test database to be used during the training sessions. And this separate database can be very valuable in the training process, because it allows the employee to actually try the system out, to make mistakes on the system, to take the separate time to go in and practice on their own as well too, without impacting the actual production system itself. So having that test database gives you a tool and a resource for them to get very comfortable with the technology without having to impact the actual implementation of the production system itself.
Yes, because that fear that they have that, if I make a mistake, I'm going to break something.
That's right.
Or impact a patient's record can be an obstacle, a barrier to really learning how to utilize it very well. So that's a very good suggestion.
Absolutely, absolutely. And having that available not only during the implementation process, but during post-implementation. So as you bring on new employees, as you have that attrition that happens, you still have that available for new employees, as well as you start to implement new features and functionality. They have a way to go back and test it and get comfortable with it and train with it as well too.
Because having to create the reports that are required for the incentive program, Meaningful Use, and also for the QPP, the Quality Payment Program, it's vital that they know how to use the functionality to create and generate the reports, because it will have such a direct bearing on the incentive and also the reimbursement through QPP.
That's absolutely correct. And it also gives you a chance to test out the workflow that's been designed or at least initially implemented in the go live process, which also gives them the ability to provide input into that, which allows you to make adjustments to it prior to go live as well too. And so if you're looking at ways to collect data for the incentive programs and that workflow may not be the best workflow, the test database gives you the ability to make those mistakes, to try it out and see, well, maybe we should do this a little bit differently, and maybe we should configure the system a different way because it works more effectively to get this quality data. Also, when those class sessions are completed, it's important to have the staff go back to their regular work areas, and either through the test system or through a series of scenarios you take them through, make sure that they're very comfortable with using the system. It's also encouraged that during the go live process that you limit the number of patients during that time period so that they get comfortable with the functionality without having to be overwhelmed with the patient volume as well too. So we encourage an active training program. It's also important to have very solid super users and senior folks on your team who have an in-depth understanding of the system itself. So you may have this initial user-based training, and then you may identify 1 or 2 people within your practice to get system admin training, train-the-trainer training, so that you have those resources on your team going forward. Any questions?
That is, I don't think so at the moment.
Again, we talked about having super users identified on your team, taking them through extra training and administrative training so that they become a support arm and a resource for your less experienced users. In addition to having them involved in user groups as well too. Many vendors have user groups that these individuals can participate in, where they can interact with other individuals who are using these same applications, get insight from them, and a support system that they can reach out to if they have questions or concerns about the application itself. Now, scheduling those trainings, those individual trainings with, in many cases, the physicians and clinicians who may not have been comfortable with the in-classroom training, doing that on an individual basis, shadowing those folks during the initial phases of the go-live, and then providing some ongoing kind of assessment of those individuals to make sure that they have a good understanding of how to use the system and answer any follow-up questions and concerns that they may have. And it's also important to establish a very effective communications tool for the end users as well also, so that as there are upgrades, enhancements, changes to the workflow, that you're actively communicating this information out to them, and you're making sure that they've adopted those changes to the system as they continue to use it in the clinical environment. Any questions?
We did have a question from an audience member, and they wanted to know, how can you use your EHR? What kind of training do you have to do to be able to generate the reports that will be required, and will the individual costs outweigh the benefits?
Well, I'm a firm believer, again, in investing as much as you can in training and extending the knowledge of your end users, because you will maximize the return on investment of these technologies. And so many of your vendor partners will have specific types of training. They'll have end user training, they'll have reporting training, they'll have administrative training, and other types of training depending on what that individual's function will be in the practice itself. So I would work very closely with those vendor partners to understand what's available. I'd work very closely with the super user and end user community to see what they found as potential pitfalls or ways to deliver that training for their end users as well, and leverage their best practices going forward. And then and the planning phases of the implementation, understand what the system is going to be used for, understand what reporting requirements you're going to have, and make sure that when you're implementing the system, you're implementing the workflow and you're delivering the training in a way that is going to meet those downstream requirements as well.
Great answer, thank you.
You're welcome. So strategy number three, workflow optimization. Here's an area where I think many practices miss a real opportunity as well. They'll make huge investments up front in the preparation and then implementation of the electronic record systems and practice management system. And then they'll go through the implementation process. They'll develop the training, they'll get their people on board, and then they'll implement, and then they'll just go forward with the use of that solution. But what many of them miss is this opportunity to do optimization. What we find in many cases when we've worked with our clients is that about 3 to 6 months into the use of that EHR, they recognize that there are workflow issues that are starting to bear notice. They'll recognize that there's functionality in the system that they're not fully taking advantage of, or may not even be aware of in some cases because they weren't trained on it. And here's an opportunity now to truly optimize the system to meet some specific needs that you may have to optimize your ability to move patients through the care process more effectively. And so, going through an exercise of workflow optimization allows the practice itself to get some relief in some cases on administrative tasks. It can help reduce some duplication of data entry, and it can save time in the delivery of care for those patients, and also make sure that you're getting the types of reporting on the back end that you need as well. So EHRs have many functionalities that really have an impact on the workflow itself. So anticipating what those changes are and mitigating any potential disruptions in that change can help to ensure really a smooth transition as you start to adopt and automate the workflow in your environment. So according to the Department of Health and Human Services, EHRs can affect a number of different parts of the practice, and they've identified some here. For example, managing messages, scheduling patients, the registration process, the assignment of the patient to a room, the actual exam process, the medication, in some cases reconciliation or medication management component, and then the discharge component. These are all key areas that have real opportunities to improve the workflow and optimize how the patients move through the system. And it's really important up front to understand what your current workflow is, how the systems that you're implementing will be impacting that workflow, and making some decisions around whether or not you're going to customize the system because you feel like your workflows that you have existing are optimized, or starting to adopt some best practices based on how the systems have been developed. So enhancing the EHR means focusing on really 4 top areas. Building direct data interfaces. So when all patient data from both within the practice and from outside of sources is routed through the EHR in a very structured format, a physician has all the information required at the point of care for the treatment of the patient themselves. Organizing that patient data to provide a central point of access in the EHR is immediate, organized, and provides complete information to help reduce unnecessary office visits, imaging, and lab tests. Establishing a preferred or predefined care alerts will help guide the physician through the treatment portion of the visit. Provide parameters and alerts that can be set by the physicians based on various different best practices and other types of quality metrics. And by setting up those alerts that are triggered by the receipt of structured data instead of manually being triggered, the practice can become much more efficient. It can provide customized treatment plans. It can reduce redundancy in tests. And setting up those alerts will allow the physician to be armed with a very educated decision-making process at the point of care when time is really of the essence. And then finally, integrating population health management reporting tools that will allow the physician to see the gaps in care or future care needs based on gender, age, medical history, for example, such as immunization or colonoscopies or foot exams or other types of standard care. These tools offered in most EHRs can allow you to analyze this data through the EHR, HIEs, or claim systems, and really provide patient longitudinal medical record. And this offers the ability to bill for services during the patient visit, send campaign messages to the patient, and report data in a very useful format to referring physicians and to other healthcare providers. Finally, on workflow optimization, when optimizing the EHR, the physician could benefit from, again, working very closely with your local regional extension center and experienced consulting team to make sure that you implement the best practices on workflow optimization. Things like, for example, lab results, radiology results, and report interfaces that might be available to streamline the interoperability of data in those systems. What data can be submitted electronically versus manually that will help you support incentive programs like MACRA and others. And then what devices such as mobile devices, kiosks, wearables, and others that might allow you to provide data directly into those systems. Question?
Yes, I have a question. So this actually came from our questions that we asked of those who signed up for the webinar. What options are available for practices with varying EHRs systems to share information and communicate timely? Because it is so very important to create that longitudinal record and to have interoperability and to coordinate care. What if they're a collaborative and they have disparate EHR systems?
Exactly. And that's always an interesting question. And typically what I recommend with our clients that we work with is, first of all, ask yourselves, why are you leveraging multiple EHRs? And do you have the discipline to move to one platform? Which quite honestly is the ideal and preferred method if you can all be on the same platform. But if there's a legitimate business or clinical reason for having to leverage multiple systems, then there are technologies and systems that are out there that will allow you to exchange patient information. For example, the health information exchanges that are available. There are interfaces that you can build. There are data warehousing that can be used for reporting purposes, and other methods of exchanging information so that there's a more seamless flow of information through those disparate systems. But again, I want to stress the point that whenever possible, if you can move to, for example, if you're using multiple EHRs, if you can move to one billing system that allows you to push data through one system, that allows you to be much more efficient and effective. If you can use one clinical system, ideally that's the best approach to take as well. But if not, you can use some of these other third-party methods of exchanging data.
It's good to know that there are viable options and solutions that can still facilitate the exchange of patient information securely, of course.
Absolutely. So we'll move on to strategy 4. How do we turn IT into a utility? I recently wrote an article around this subject, and I provide a comment here, which we'll share the slide deck for the audience to read. But what I state here is basically IT is now becoming really the next utility. When you think about the water and lights in a clinic and how important they are to the care process and how you use them based on the demand. You turn the lights on when you need them. You turn the water on when you need to use it. IT can be designed in a way where you use it based on when you need it as well too. You don't have to continue to make these huge capital investments in infrastructure that you may or may not get the return on investment in. And so looking at IT as a utility whenever possible will help to better position your organization to fully maximize its investment there and reduce its ongoing expenditures and capital needed to maintain this technology going forward. And we'll talk a little bit about that. For example, cloud computing is one approach to really commoditizing this technology. And so whenever possible, exploring opportunities to implement cloud computing-based solutions. There are many EHRs and practice management systems and other systems, email, HR systems, etc., that are on the market today that are now cloud-based solutions. Those cloud-based solutions require, an initial upfront cost, but those service fees, which include service fees and monthly fees and annual fees, but in many cases they don't require huge investments in technology infrastructure. You can use a lot of the current investment in infrastructure that you have to gain access to these systems. They allow you to scale based on demand. So as you add more patients, as you add more clinicians, as you add more locations, you're not having to necessarily add huge capital outlays in hardware, network infrastructure, etc., to gain access to that same system, or staff to support that system as well too. In addition to that, you have service levels that you can that you have in place that allow you business continuity and disaster recovery of those systems in a more effective, cost-effective way, as well as you can now integrate those systems in many cases with other third-party applications that you have in a more cost-effective way, because you can work directly with that vendor partner who in many cases have already built those interfaces into some of those third-party systems. Questions?
I have a question that was inserted into our pod. Does a vendor typically assist with defining processes and workflows and reporting requirements, or does an outside consultant help with this prior to an engagement?
I think it's in some cases it can be either or. You have many vendors who have the professional services arms of their organizations and can assist you in those areas. And in some cases, you may want to seek an outside support group. And again, you may want to work with your local regional extension center to understand what they can do to support you in some of those areas, or make referrals to you of third-party consulting groups that can assist you as well.
Okay. would you like to field the other question that
Sure.
come in? Okay. It says all the EHR programs today are template-based, and those that are VRD-based are having difficulties in meeting government IT requirements, such as meaningful use and now MACRA, because they're not structured. Are you familiar with EHR programs that use VRD technology that are structured enough to meet MACRA and meaningful use requirements? Is that a question we want to answer offline?
Well, I think that's a question you want to pose to your regional extension center contacts who can assist you in that area as well. We don't necessarily promote one particular vendor in these webinars, but there are vendors that are out there that can provide that support, or there are applications and overlays that might be able to support you in those areas as well too. So I would encourage you after this webinar to send us an email, and we will be happy to follow up with you and try to assist you in that manner.
Thank you.
And so for the sake of time, I want to make sure we get through the remaining part of the presentation. I just wanted to point out also, as you think about commoditizing these technologies, finding opportunities to co-opt what maybe with other physician practices and clinics, and sharing the use of infrastructure, for example, data centers, again, other cloud-based solutions. Buying those solutions as a co-op will also allow you to reduce the cost associated with that and commoditize that in many ways. And give you stronger negotiating power at the table when you're sitting down with those vendors, vendor partners as well. So just to wrap this up, really securing technology as a service, for practices that don't have, in many cases, the resources available to them, leveraging more of a utility or utilitarian model for technologies that have huge cost implications to them. Looking at cloud-based solutions or infrastructure-based as a service type solutions allows you to move those capital outlays into more of an operational cost. Again, looking at things like leasing technology versus whether that's your desktops or servers or mobile-based solutions, network solutions, versus having to buy that capital out, buy that from a capital perspective. Again, helps you commoditize that more effectively, spread that cost over the long term, and creates a built-in lifecycle management process for those solutions as well, too. So as you get to the end of the term of those leases, you have an automatic refresh that can take place in many cases in the technologies that you're purchasing also. And I would not, limit that to just, EHRs and practice management systems, but look at all other types of technologies that you're leveraging within your practice. For example, an X-ray system, a sonogram, MRI, and other clinical systems have other creative financing programs that you might want to consider as well. And then finally, we want to touch on governance and what I believe is a very key process. So whether you're one or two physician practice or a large, multi-practice organization, establishing an effective IT governance structure, I think, is absolutely important to the success of your maximization of technology. And there are all sorts of definitions around what IT governance is, but I like the one that's highlighted in red here, which was given to us by Forrester Research. And basically, it's the process by which decisions are made around IT investments, including who makes those decisions, how those decisions are made, how the outcome of those decisions are measured, and how the decision makers are held accountable. At the end of the day, it's about how we make and manage our IT decisions. No longer can we just rely on the IT guy or the IT leader in the organization to be the only person who is making these decisions around technology. The return on investment comes from the business owners who ultimately have to use the technology. And so they have an investment, a stake in making sure that we purchase the right decisions and we know how we're going to get a return on those decisions going forward.
So then the business goals and the clinical goals, they should really drive how we plan to utilize EHR to support the meeting of those objectives and goals.
Absolutely. IT in and of itself is an enabler to the business and clinical goals, and we shouldn't be purchasing IT for IT's sake. We should have a clear understanding of what the business and clinical initiatives are and how we're going to now leverage IT to help support those clinical and business goals. And then we should have standards that we've made decisions around in terms of how we make those decisions around IT. Are we going to be on one physician practice system, for example, or one EHR? We're not going to have multiple EHRs. We're going to be on one standard platform. Let's say we're going to be on Microsoft Shop, so we're not going to introduce other types of technologies in our environment. We're going to only purchase, Dell systems versus HP. Are we going to move as much as possible to cloud-based solutions versus client-server solutions? You need to sit down as an organization and establish those standards. So again, real quickly as we go through this, some of the challenges many organizations have as they start to have to embrace technology is just real lack of discipline around governance. So in spite of the amount of dollars that they're currently investing in technology, there's typically very little discipline by the senior leadership on how to select and improve IT investments, and that's extremely important. You can't allow everybody in the organization the flexibility to go out and buy what they want. There has to be standards in order to effectively manage the cost and maximize the investment. A majority of organizations really skip ahead of the investment without first establishing those guiding principles. And so it's really important, as I stated earlier, to understand why you're purchasing your technology and what those guiding principles would be. And then the lack of that discipline and objective criteria leads to really some challenges around prioritization of your projects as well too. And so what I call the tyranny of the urgent. And that is whatever the most urgent issue of the day is, that's what we're spending all our dollars and time around versus saying, here's our goal and standards and strategy, and here's what we're going to invest our resources around, and staying very focused around that as well. And then finally, many business leaders abdicate that responsibility to the IT person versus taking some personal accountability for the success of implementation. And so balancing that ownership burden, it's important for the business owner to make sure that they have accountability for the investment of technology and the use and the adoption of that technology within their own business unit. So the IT person can act as the technology knowledge professional, but it's up to the business unit owner to make sure that their staff adopt the use of it and they maximize the investment as well, versus putting that blame back on the IT professionals.
And so in a small practice, it would be up to the provider to have some measure of understanding of the impact that their decisions will make, and then follow through to be sure that it is generating the kind of feedback that they can utilize to make more effective decisions in the future, or to optimize their reimbursements. That's or right. To manage, populations of patients. Exactly. And meet their clinical goals as well.
Exactly. And even in a small practice, putting together a group of individuals who are going to help you make those decisions are important, whether they're internal to your organization or external to your organization. It needs to be a collective thought process around that, because when you do that in a silo, you miss some of the extenuating factors that might affect your purchasing decisions as well too. So working with your regional extension center or an external consultant, or your internal staff, whether it's one or two people in making those decisions, it's more effective than you doing that on your own.
Because providers are quite overwhelmed with just the daily patient care issues.
That's right. Mm-hmm. That's right. Or assigning those responsibility to someone else and abdicating that responsibility away from yourself. That may be an approach you might want to take too. But at some point, someone in the organization has to have that accountability. So hardwiring that accountability into your organization allows you to make more effective decisions. It puts more accountability on the business owners as well too, versus just the IT personnel. And it's a very much an evolutionary process as well too. Establishing discipline governance doesn't happen overnight. You have to continue to work at it. You have to continue to hold yourself accountable to it. And you have to continue to make sure that everyone in the organization is following the process for making those decisions. And we'll talk a little bit about that ideally. I won't go into great detail in this just because of time, and we can maybe do another seminar where we talk a little more about governance in detail. But having again a structured committee, a group of people who are going to make those decisions are important. Securing greater business involvement, so those department managers and physicians in the organization who are going to be using the technology, making sure that they're accountable to governance around the return on investment. ensuring there's a continuity of information across committees. So if you have multiple departments, making sure everyone is looking at how we leverage technology across the organization, and not just for our individual departments are important. Committing resources from IT to support that whole governance structure is important. Engaging the leadership in determining, IT strategic work. What's the value of IT for our organization? How we're going to measure that. Deriving those operating principles we talked about. We're going to have standard platforms. We're going to go to the cloud. We're going to do other types of standardization are important. And then defining what those business-driven standards will be also. And then remaining flexible, because things change. Regulations change. Technologies change. And it's important for us to be flexible in how we make decisions around technology. And we can drive into that at another time and talk about that in a more detailed perspective. Finally, this is just a general structure around a really disciplined governance process, and it starts with really the department sponsor, someone who has an idea or a thought process around technology they want to acquire. You want to work with a group of business owners within the organization to help vet that out and create a business plan. You take that to your overall governing IT steering committee or individuals who are going to make final decisions, and then you work really closely with your IT leaders to make sure that it meets the standards that you put in place, and that you thought about the ongoing operational expenses associated with that implementation.
So the principles would be applicable even if it's a very, very small organization. They still have to think about and decide on the structure of that governance. It might be the doctor and their spouse or their office manager.
That's right.
But the principles still apply in order to effectively utilize the output that you can get from your EHR to make decisions.
That's right. And even with the small practices, they have to make a conscious decision that they're now moving. IT is now an investment, just like the brick and mortar facility. Again, the water, the lights, the clinical systems that they're using. They're also now deciding to use IT to drive clinical care. And because of that, they're going to have to make some investment in their ownership of that, and making sure that they've surrounded themselves with knowledgeable people who can help them make really smart decisions. So finally, as I mentioned earlier, governance is a marathon, not a sprint. It's governance, it's easy, but disciplined governance is really a challenge. We can all make decisions, but can we make really disciplined decisions and stick to those and hold our staffs and organizations accountable for that? Everyone must work together and be held accountable to ensure that, the organization gets the buy-in and supports those decisions going forward. And success is really measured by how IT successfully impacts the organization's mission and vision itself. So final thoughts. We talked about a lot in a very short period of time, and I know there's probably a lot of other questions that are out there, and we're happy to entertain those questions after the fact, so feel free to send us an email or communication directly to Phoebe and the staff here at the Regional Extension Center, and they're happy to support you in that. But it's also important to recognize that when you've decided to make this investment in technology, you've decided then to make this a part of how you're going to deliver care. And so it's just like the stethoscope, it's just like the syringe, it's just like, the EKG. That laptop, that printer, that device is now a part of the care delivery process. And so investing in technology, again, whether it's hardware, software, diagnostic equipment, or other necessary products and services, is now a reality today. You can't abdicate that and pass it off to someone else. The organization has to embrace it and leverage it just like they leverage the other systems that they use. It's also essential for the leadership, whether it's a single physician practice or a multi, practice facility, to become more educated. You don't necessarily have to be the guru and expert, but you have to have some basic understanding about how these technologies are going to impact your environment. And become disciplined about how you use and govern them as well too. The overall goal absolutely should be leveraging those technologies as a tool to support their efforts in providing the very best care to each and every patient. At the end of the day, that's what it should be used for. And if it's not being used for that, then you need to be asking yourself the question, am I making the smart investment in these solutions as well? So that's all we have for today. I hope that was helpful for those who are listening in. Again, I know we covered a lot in a short period of time, but are there any final questions?
I want to thank you so very much for the information that you've shared with us. And just to recap, it seems as if the benefits, some of the highlights, the benefits, would be that it can really impact in your reimbursements going forward if you are participating in the quality payment program under MACRA. It can help you with your meaningful use reporting. It can help you coordinate populations to design care plans, compliance with the protection and security of patient information, financial reporting for your operational decisions, efficiency, increased efficiency in the practice, and facilitate interoperability, the exchange of information to support the coordination of care and capture a longitudinal record for patients. So that's quite a long list of benefits and advantages that makes it the investment that all practices have to make in electronic health records definitely something that will pay off.
Absolutely, and again, it's important to create a foundation around governance, around training, around partnership with your vendor partners to ensure that those things you just mentioned become a reality as well too. And so keeping those things in the forefront of your mind as you're starting to go down this path of leveraging technology to meet those requirements, you want to institute these effective approaches to ensure the success.
And with the in the news, the forefront of everyone's mind is security, mm-hmm. And of course we want to be sure that we utilize all the resources that are available to our practice to protect and ensure the security of our information.
Absolutely, and that's a completely another topic that we should probably talk about in the future as well too. But we recognize that it's part of our compliance and responsibilities as care providers that we need to make sure that that information is secured, protected, and available to not only the patients but to the clinicians who have to use it on a regular basis. Because once you move from paper-based environments to electronic environments, you now need to make sure that electronic environment is secured and there's a high level of business continuity, access to that patient information at all times.
Excellent.
Another topic for another day.
I can't thank you enough. This has been wonderful and informative, and we thank all our attendees for attending.
Thank you. Pleasure being here.